You know, for over 39 years, Coastal Family Health has been servicing the people of the Mississippi Gulf Coast. And we wanted to come talk to their CEO and find out more about what they do, the services they provide, and everything. Angel Greer, how are you?
I'm great, Jim. Nice to see you.
It's nice to see you. Tell us a little bit first, if you would, about the history of Coastal Family Clinic here on the Gulf Coast.
Absolutely. Coastal Family Health Center was first started as a health ministry from Back Bay Mission. In the mid-70s, they saw a need where young women of color who needed OB care and needed labor and delivery were not being served by our local hospitals. And so the members of Back Bay Mission said, we've got to do something about this. And so they went out and pursued grant funding to make health care available for those in need. Mm-hmm. That's where we got our first start. That was back in the mid-70s. We were established in 1978, and we've been providing care for all across the Gulf Coast since that time.
Well, talk about the different services that you provide and the different areas, the different sites that y'all are located.
Absolutely. Well, since those early days, we started out with just medical care, and then we added dental. Since then, we have optometry, we have radiology, including mammography, ultrasound, x-rays. We have in-house lab. We have our WIC program for the Women's, Infants, and Children's Nutrition Program. Mm-hmm. We have HIV care, internal medicine, family practice, and pediatrics. We serve all of the Gulf Coast. We have locations in 5 counties, Harrison, Hancock, Jackson, as well as Greene and Wayne counties.
Wow.
Last year alone, Jim, we served over 32,000 individuals.
Wow.
And provided over 105,000 visits. Mm-hmm. What most people don't know about Coastal is we're not a free clinic. You know, a lot of people think that Coastal is for the poor and uninsured, and that is, that's the focus of our mission. That's really the core of why we're here and how we got started. But we serve everyone. Last year, we served over 2,300 senior citizens that have Medicare.
Really?
Over 5,000 children with Medicaid.
Excuse me.
And over 7,000 patients with private insurance. So they choose to come here.
Excuse me. I think I might have to get a little checkup while I'm here myself. Tell us some of the things that people don't know about Coastal Family Health.
Jim, probably the biggest misconception about Coastal is that we're a free clinic, and we're not a free clinic. I believe that misconception may have started after Katrina, when we relaxed our payment and collection policies in order to serve the need here on the coast in the aftermath of that. But we partner with free clinics. The other misconception is that everything that it takes to operate Coastal, which is about $22 million these days, comes from the federal government, and it certainly doesn't. Only about 30% of our operating cost comes from the federal government. That 30%, Jim, allows us to provide discounts to our patients who qualify based on their income and their household size. Mm-hmm. And so last year alone, we provided over $8 million worth of services that were adjusted because people qualified for those discounts. What most people with insurance don't know is that they may qualify for discounts for their co-pays, their out-of-pocket expenses, their deductibles, and their co-insurances if they qualify based on their income and household size. That's probably the biggest unknown factor here at Coastal that we can offer, is you've got a $25 copay. If you qualify for the discount, you may not have to pay all of that.
Wow.
So that's good news for our folks here on the coast, especially with everything, the prices of everything increasing and, and healthcare insurance increasing and us having to pay more of that coverage.
Well, that shows me that Coastal Family Health is really focused on the community and helping the community here on the Gulf Coast.
Absolutely. Our community focus has been a cornerstone of our mission since we started in 1978. We do quite a bit in partnering with folks around the community. We have certainly been participants of WLOX's senior fairs. Mm-hmm. We work with XL by 5 in the various communities that we serve. We participate in the Farm to Fork event over in Moss Point and a couple of other areas. We partner with the local Head Starts to give them the screenings that they need for their children. Whatever we can do to serve a need, to help leverage the resources that other people have in the way of health education, health services, or screenings, that's what we're here to do. I am proud to tell you, though, that this August, Coastal is actually going to host a 5K fun run
really?
And walk. It'll be our first time doing this, and so stay tuned for the details. We're hoping that all people will come out and join us. This is really part of a statewide initiative. We want to focus on the diabetes and obesity epidemic, and we want to really highlight the benefits of physical activity in combating those two problems.
And more and more people are really getting involved in doing these kind of 5K runs and things like that, in which they really enjoy getting out and not only helping a good cause, but it's also, as you said, it's healthy for them.
Absolutely.
Talk about the impact that Coastal Family Health has to the Gulf Coast.
Okay. I may repeat myself, but last year alone we served over 32,000 patients here in South Mississippi. We employ people from our community. We don't look outside, to hire our folks. We want to care for our friends, neighbors, and family. Our salaries and fringe, all of that money comes right back into the community. It was over $9 million last year. We hire locally. We try to purchase as much as possible locally. And so, improving our economic status here on the Gulf Coast is a win-win for everyone. In addition to that, we saved our Mississippi residents, the people that we see every day, we saved them over $8 million out of pocket.
Wow.
Those dollars, Jim, were able to be funneled toward their housing costs, their food costs, and child care costs. Those are just a few of the highlights that how we've impacted the Gulf Coast.
Well, we got about a minute and a half left. Success stories?
Absolutely. We collect patient satisfaction surveys on a monthly basis. Our board, our executive team, we look at the comments from these patient surveys. We get 400 a month.
Wow.
And I routinely see, comments where people are so appreciative. They are amazed at the level of care that we provide from our board certified physicians and nurse practitioners and other healthcare professionals. Just a few weeks ago, I received an email from a gentleman who did not have insurance, and our clerks were able to get him signed up and enrolled in healthcare coverage. He was able to get referred for orthopedic surgery, and he is a great fan of Coastal Family Health Center. He said, I was amazed. I didn't know Coastal could do all of this. But what we do that on a daily basis. What other people consider as above and beyond, it's just part of our mission.
Sounds like a great place to work.
It is a great place to work. We offer family-friendly schedules. That's what we're here for. That was what first attracted me. And so it's important that we maintain that work-life balance for our folks.
Well, I know we've talked to the folks over in the pediatric center here on several occasions, and I mean, it really is a great place. Thank you so much.
Thank you,
for
Jim.
letting everybody know about the history behind Coastal Family Health and everything that it does for to help people and for the community. And for a location near you, you can call the number on your screen. You can go to the website and find it exactly. They're located where we are today in Biloxi, but again, there are several locations along 5 counties. You said 5 counties. If you need them, call them and go see them at Coastal Family Health.